Well, high blood pressure is a very common disease. It is not genetically transmitted. It's a simple acquired disease. In most cases, it's caused by a mineral deficiency, and you take the complete set of minerals, all 90 essential nutrients with a complete spectrum of minerals, and in most cases, the blood pressure will begin to drop. And blood pressure is one of those nice things. As your blood pressure drops, you can monitor yourself, keep a log, keep track of your own blood pressure, and as the blood pressure drops, you can wean yourself off your medications. On occasion, if people have what we would call kidney failure, you can also cause high blood pressure because the kidneys will release a hormone called renin, R-E-N-I-N, which drives the blood pressure up, trying to drive more blood through the small blocked blood vessels that result in high blood pressure. So what do we do for high blood pressure? We like to give the 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And in case there's a circulation problem contributing to this, I like to throw in the ultimate daily tablets, and this will support and promote healthy blood flow through obstructed arteries and also support healthy blood pressure. Don't forget to give up the inflammatory foods, fried foods, processed meats, things like deli slices, sandwich meats, sausage, ham, bacon, bologna. You have to give up gluten and oils. No olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils.